Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Okay, cervical hostility is tested by the following. Cervical hostility is tested by postcoital test, sperm Burkitt and Miller-Kurzroll test. It is not tested by Keller's test. Then postcoital test showing non-motile sperms in the cervical smear and there are motile sperms from the posterior fornix. If there are non-motile sperms in the cervical smear and motile sperms in the posterior fornix, it is mainly by immunological defect. Treatment of cervical infertility can be all except condom for 3 months. Yes. Intrauterine insemination, gamete intrafallopian tube transfer. It is not involves clomiphene citrate.
Clomiphene citrate is an ovulation induction drug. It does not have any action on cervical infertility.
In a lifestyle factor, if the lifestyle factor that is causing infertility in young male is identified, which of the following lifestyle modification, if the lifestyle factor that is causing infertility in a young male is identified, which of the following lifestyle modification will have no effect? Vegetarian diet. The vegetarian diet will have less or no effect on infertility.
If the person starts to do exercise and lose his weight, or if he has started doing his exercise, then the lifestyle factor might improve and the young male might become fertile. But vegetarian diet has no effect on fertility.
Then, according to WHO criteria, minimal normal sperm count is 20 million per ml.
thank you and thank you for watching.